Welcome to Facebook Live. I'm Dr. Annette Mercatante from St. Clair County Health Department. And as always, we're here at 3:30 on Thursdays to give you an update on COVID and answer your questions. So let's get right up to the data. This is our totals to date, 22,000 cases plus with 476 deaths and 861 hospitalized. You'll notice that our percent of positive tests is up to 14%. And in the last 7 days, we've had 6 additional COVID deaths. Next slide. And this is our epigraph that shows this ongoing steady increase as we're seeing throughout the state. All of the indicators continue to increase somewhat slowly, which includes average daily cases, case positivity, and hospitalization rates are all continuing to rise. A little too early to tell, but the last few days have been a little more static and stable, which might suggest we have finally reached a plateau. Yep, and then the next slide shows the vaccination rates. A little hard for me to see that, but I think you can all notice that this week's vaccination rates have dropped significantly from previous weeks. We were maintaining a 300 to 400 doses per week prior to this, and now we are under 300. So hopefully that is not a trend that will continue. And of course, we have some of the new boosters and in the horizon, the pediatric dosage of Pfizer that may boost these numbers as well. And a new graph. This is something that came out recently. You've showed the time trends and the comparisons. So on the blue graph is this current year, and the dark line is from the year before. And you can see the dark line, and these two are interposed so that this is the same time. So the dark line is and the blue line are kind of the same time, 1 year apart. And you can see that 2020 holiday wave, which we all believe was primarily prompted by people going indoors with the cold weather, the holiday gatherings, etc., that really drove this wave. We still have that concern, but if you'll notice where we are now with the light blue wave, our baseline, if we are to go into a holiday surge, our baseline is already considerably higher than it was last year, which is creating a little bit of concern. We're all kind of watching that very closely. So I think this graph is helpful. And then our usual data dashboard that you can kind of ongoing running numbers as we report them daily. All right, get to your questions. And oops, what did I do with it? There we go. So the first talking point our staff wanted to give you was the Moderna and J and J booster. Yesterday, the FDA approved boosters for those who initially received either Moderna or J and J as their primary series. And I want everyone to know that while the FDA has voted and approved this, we still have a couple of hoops to go through. Right now, as we speak, the ACIP, the Advisory Council on Immunization Practices, is meeting on this as well. Generally speaking, what the ACIP votes on and approves is what goes into the CDC publications, which is what we follow for our standing orders as far as the guidelines for vaccination. So although the FDA has approved Moderna and J&J boosters, we are anxiously awaiting for the vote this afternoon to come through and for those recommendations to be published. And that gives us the guidance that we need to officially get everything put in place here to appropriately vaccinate everyone as they come through. So of note, and I've kind of been talking that this wasn't on the radar, but apparently it is, the practice of mix and matching booster doses. For example, if you got a J&J, you could receive a Moderna or Pfizer as a booster. Listening to their arguments and reviewing the data, I'll still support the fact that there's not a lot of strong data for this recommendation, but there's a lot of indications that not only will it work, the potential of it working well and not causing harm, and then the logistics of just being able to provide more booster doses for people. So we'll continue to follow those recommendations. And vaccine providers. So remember that besides ourselves, and we'll continue to provide all of the vaccine formulations and options here at the health department, but we want you to make sure that you know that pharmacies are still in the game, as is many of our healthcare providers, and we'll be working closely with our healthcare providers to make sure that those who are interested in having COVID vaccine will also be out there. So don't forget your flu shot. We are still concerned about a flu season of even moderate severity superimposing on the current COVID rates, which clearly every layer of people getting sick and needing hospital care are going to add extreme burdens on our system. So please, if you've never considered a flu shot in the past, uh, or even if you have, please go get your flu shots now. One of the questions I wanted to follow back on is a question of, is a flu vaccine free at the health department? I had to double check that, and I apologize, but the answer is technically it's not free. We do bill insurances, and all insurances cover flu vaccine and all vaccines, in fact, with no copays or deductibles. So the answer is there's no out-of-pocket expense in particular. And if you don't have health insurance, we do have some flu formulations available for those people as well. So no out-of-pocket expense for flu shots here at the health department. So if you have additional questions, you should give us a call. And the other question is, where can I get the COVID vaccine for my child once it's approved? So we will, again, I said we're working on that. I can tell you right now, we're not actively planning any large COVID clinics like we had back in the winter when COVID vaccine first came out. We don't think the demand is and the need will be there to set something up like that. We urge you to call your pediatricians for further information, because we're going to be working closely with our pediatricians to make sure they have access to this vaccine as well. And of course, we'll be working on our own resources to have that vaccine available here as well. So more to come. Now we expect uh, the Pfizer formulation for pediatrics, the 5 through 12-year-olds, to be coming out somewhere closer to November. I believe the ACIP is meeting to discuss that the first week of November. So we should be have a lot more information for you then. So a couple more weeks for planning related to that. Okay, that's what I have on my talking points. Elise, do we have any questions that have come in?
Yep, we have one live question so far from Julia, and she asks, when will boosters be available to everyone who received Pfizer?
Oh, I see. Because right now the Pfizer booster is recommended for individuals high risk or in high risk situations. And the answer is if you feel that you're at high risk, no one is going to refuse you a booster. Okay. You notice how that's worded, the booster recommendations for high risk groups. So, I guess if you're a healthy 40-year-old and you feel you need a booster because of your exposure risk, that would fall into that third category if you have an occupation or you have a lifestyle that would put you at risk for exposure. So I would just say if you feel strongly that you want a booster, I would present to get your booster.
All right, we have another question that just came through. It's from Dakota. Is a pediatric vaccine guidance authorized for emergency use only or full FDA approval?
So when it comes out, and we're pretty confident that they will approve it, it will be approved under emergency use authorization. As you can tell, the only um, formal FDA approval so far has come through for the Pfizer 18 and over. Everything else we use Pfizer for is still under the emergency use authorization. I believe Moderna has submitted its data for FDA approval, but and this is why we have emergency use authorization, people, because full FDA approval is a time-consuming process. It has to go through all of these iterations of review even though the data is exactly the same. So it's just going to take a little longer to get all of the rest of them up into that category.
All right. We don't have any questions right now on the live feed, but I would just encourage people, if you do have questions, put them in the chat and we'll answer. And just to circle back one more time, Doc, from what you said about your talking points, if people are looking for flu or COVID vaccine and maybe your schedule doesn't align with what we have on our website for the appointments, you can always go to vaccine.gov as well. All
Hmm.
right, to find a local provider. So we do have another question from Sharon. I had the pleasure to talk to a nurse named Amy today. I had a question regarding an antibody blood level result. I just want to say thank you. She was amazing.
We have amazing staff. I know that because I am constantly amazed by them as well. Um, I may be the medical health officer with the license, but I'll be honest with you, some of our staff can run circles around even me with the data that they follow. So we work as a team to give you and bring you the very best information we can. And I'll say this too, that if we run into a situation where we don't know the answers, we don't lie. I hope we don't make many mistakes either. We stop, we research it, and we try and bring you back the best information possible. So I'm glad Amy was able to do that for you. Yeah, I know Amy's terrific. So thank you.
All right, next question is from Linda. Will there be a continuous booster every 6 months?
Hard to say, Linda. Hard to say. As you can tell already, how many times now the scenario has changed for fighting this virus. Um, if we get significant uh, variants, it's possible. We are seeing even natural immunity wane. What that means for actual reinfection rates is a little hard. I noticed today, I was reading in the literature, the UK is having another surge. And so, these are all things we're just going to have to watch. Is it possible that we will need boosters on a periodic basis? I would say yes. I think the nature of coronavirus is that immunity just isn't as long lasting as in some of the other viral situations. So we will find out. And if we need boosters, we'll provide them and we'll get them to. It's one nice thing about living in the United States, right? We're not fighting for vaccine. We're fighting for against the misinformation campaigns that are going on instead. So um, I trust we'll have good data and good recommendations as they develop.
All right, next question is from Bonnie. Can the shingles vaccine be given at the same time as the flu shot?
Yeah, so these vaccines can all be co-administered. What they're uncertain of is, so we know that the side effects are not increased and the efficacy is not changed by co-administering. But the shingles vaccine and some of the flu shots are both what we call adjuvanted, which means there's things in there to make them work better. And in those situations, you might have more of a local side effect. And if you've had a significant problem in the past with a local arm tenderness, things like that, you do have the option of separating them, but it's not required to separate them by any amount. And both of those vaccines, by the way, are not live viruses either. They're both um, components of viruses, so they don't interfere with each other.
All right, thanks, Doc.
Hmm.
Next question is from Bert. Is it possible we are reaching a plateau of cases in the county, or do you anticipate continued rising cases?
Wow, it's $100 million question. It is possible that we're reaching a plateau in the county. Although I have to say, I doubt it only because when you look, I don't think we've had more cases than other people. I'm assuming you mean could kind of to confer kind of a natural immunity that would damp this down. And when you look at other places, they're still seeing surges. So that makes me a little less confident to say, well, we've had enough cases to confer this blanket herd immunity that will prevent us from surging. Um, but I do think maybe this slow, steady increase this curve that we're watching may be because of previous infections added to the vaccine immunity that we're receiving. Time will tell. Time will tell.
All right. Next question is from Cindy. Is J and J FDA approved yet or emergency use? I am 61. Should I get the booster?
So J and J and Moderna are still under emergency use authorization, and Pfizer is still under emergency use authorization for under 18. Okay. So are the boosters? Yeah. So the booster idea is indicated because we know that all of the immunity from our vaccines appears to be waning over time, although that's a really complicated question and I won't get into the details of that. But in general, we feel like the higher your neutralizing antibodies, the more protection you'll get. And as we stare into the winter months, I think everyone feels you're better safe than sorry to boost that immune response. So if you are 61 and have done well with your previous vaccines, and you anticipate being indoors a lot with other people, I think a booster is probably a pretty good idea.
All right. Next question is from Barbara. If pregnant women receive the vaccine during pregnancy, does the infant have protection from COVID?
That's a really good question. I was just reviewing that now earlier today, and I don't think I saw anything about newborn immunity, protective immunity to the newborn. So I'd have to say I don't know particularly well. It would make sense, but I don't know for sure that those antibodies cross the placenta to give short-term protection. That's called passive antibody protection to the newborn, and it may occur, although I don't know that there's any robust studies out there to prove it. I know that the vaccine does protect women during pregnancy from severe outcomes related to getting COVID infections during their pregnancy, which we know during pregnancy you have a greater risk of having complications from getting a COVID infection. But I can't speak to how much that protection would go to your infant, your newborn infant.
All right. Next question is from Nancy. I'm immunocompromised and I received the Moderna vaccine. Should I wait until I get the Moderna booster?
Yeah, well, it's coming, so I would say you don't have to wait too long. I would think in a week we'll have that information and those guidelines available. And particularly your Moderna. Oh, I see the question because you're immunocompromised. Technically, you don't need a booster, you need a third dose. So you don't have to wait the 6 months. So remember, a booster is going to be recommended 6 months after your final dose. But if you're immunocompromised, they recommend a third dose, and that can be given a month after your second dose, 28 days actually. So if you're immunocompromised and you've had 2 doses of Moderna, you can get your third dose of Moderna anytime. If you're not immunocompromised, we're recommending you wait 6 months to be boosted. I
All
think
right.
that's the question you're asking. So let us know if I didn't nail that one right.
Okay. All right. Next question is from Shelly. Why aren't the weekly updates posted any longer? It was nice to see it all here instead of having to go on the website and download it. Shelly, they are on there every Friday at 2. So just look on our social media at 2 p.m. on Friday. All right.
That's a
Next question
technical
is,
question I can't answer. I don't know. As far as I know, they're still there. Sorry.
yep, they're still there. So just check on
Mhm.
our social media tomorrow at 2 p.m. All right. Sue asks, are the employees at the St. Clair County Health Department required to get the vaccine?
To get the COVID vaccine? No. There's no mandate for our COVID vaccine. That's strongly encouraged. And of course, we work very hard to have everyone vaccinated. The employees at St. Clair County Health Department, though, are required to get flu vaccine, and our healthcare providers are required to get hepatitis B vaccine and Tdap. So we do have some vaccine requirements, but not for COVID at this time.
All right. Next question is from Janet. Are flu vaccines available at the St. Clair County Health Department on a walk-in basis?
Not right now. They're not. We actually were having this conversation this morning if that would help, if we could have some flu vaccine days, walk in, stay tuned. Right now, though, they're available by appointment.
All right.
But I think
And
there's going to
those,
be some walk-in flu clinics available in the near future in various places. So stay tuned.
all right. I think those are all the questions, Doc, that we had today.
Wow.
Yeah.
Wow.
So any
All right.
any closing comments before we sign off?
I'm just gonna tell everyone thank you again for just doing this, right? This is a really hard thing. We are staring at the next large amount of COVID burden. And I'm just going to ask everyone to buckle down, do the right thing. The fight over are we going to mandate or non-mandate is kind of irrelevant. What's really relevant is you and your loved ones staying healthy, right? Nobody wants to get sick. Being sick is bad. We don't want you to get sick. You don't want to get sick. So you know the tools. We've been talking about them. And I'm just going to urge everyone to do those things that you know will protect yourself and the people you love. It'll be worth it. It'll be over. Sooner or later, we'll get on the other side of this and we can relax again the way we did this summer. Remember how nice the summer was? But for now, it's a good idea to stay out of crowded places, to wear your mask when you're indoors, to get your vaccine, to wash your hands, plenty of rest and get your sleep and take good care of yourself so that your immune system is as healthy as possible because this is what works. These are the tools we have. We have to work with what we know, and this is what we know. And by the way, don't forget that if you are diagnosed with COVID-19 or you are a high-risk individual who's had some exposure, monoclonal antibody therapy remains the most well-researched, effective tool we have. Despite everything you hear about these other drugs, the monoclonals reduce hospitalizations by, I think we thought about 70% is what the data is showing us right now. So it's way better than everything else we've got. Talk to your physician about it or give us a call and if you think that you might be eligible. You want to get monoclonal therapy within 10 days of getting sick, okay, or getting exposed. So the sooner you get it, the more effective it is, and it's got a very small. It's been very well tolerated. So it's something that you might have missed it. What's your feelings on monoclonal therapy? So I'm talking about that right now. Being vaccinated, by the way, has no bearing at all on what kind of treatment you get for COVID. So it's regardless of whether you've been vaccinated or not, even though if you're vaccinated, you might expect to have a less severe case of COVID. As we all know, that's not necessarily guaranteed. So your risks are lower, but you can still get nailed. So if you are a high risk person, regardless of your vaccination status, you want to try and get some monoclonal treatment into your body sooner than later. Okay? And look at our website. Do we have information on monoclonal? I hope we do. If not, let's make sure that we have updated information on our scchealth.co so that you have the ability to talk to your healthcare provider or us as soon as you need it. All right. And thank you all very much for tuning in. We'll see you next week.